Thank you, Mr. Chair. Good afternoon, everyone. The Canadian Alliance on Mental Illness and Mental Health, known as CAMIMH, is very pleased to be with you today. My name is Glenn Brimmacomb, and I am joined by Dr. Karen Cohen. We lead associations that are both longtime members of CAMIMH. In my day job, I am CEO of the Canadian Psychiatric Association, and Dr. Cohen is CEO of the Canadian Psychological Association. CAMIMH is the national voice for mental health in Canada. Established in 1998, CAMIMH is an alliance of 16 mental health groups comprised of healthcare providers and organizations that represent people with mental illness, their families, and caregivers. CAMIMH organizations came together to educate and inform by engaging Canadians in conversation about mental health and mental illness. Informed conversations create awareness, reduce stigma, and call for the services and supports that 1 in 5 Canadians need each year. Our vision is a Canada where everyone, no matter of their state of wellness, enjoys good mental health. Our mission is to advocate for a Canada where all who live with mental health problems and illnesses, their families and caregivers receive timely, respectful, and effective care and supports. Today, we direct our comments to Division 9 of Bill C-44. CAMIMH welcomes the $5 billion over 10 years that the federal government has committed to mental health initiatives. This is a historic investment that recognizes that Canadians need better access to mental health services and supports. In Bill C-44, $100 million has been set aside to be transferred to the provinces on a per capita basis for mental health initiatives in 2017. This represents a modest 2% of the total $5 billion to be invested over the next 10 years. It also represents an important opportunity for governments to take the time they need to consider how the remaining 98% should be invested in 2018 and beyond. CAMIMH stands ready to work with both levels of government so that Canadians receive timely access to effective mental health services and supports. As set out in Table 3.2 of the budget documents, funding for home care and mental health will increase to $1.5 billion in 2021 and 22. However, we are not yet aware of how these funds can be spent. We urge governments to clarify how funding for home care and mental health services over the remaining 9 years will be allocated. Doing so not only allows for accountability and transparency, but gives the provinces and territories the predictability necessary to planning and implementing complex services and supports. It is our understanding that the federal government is currently in discussions with the provinces about where the monies could be invested and what accountability mechanisms could be put in place to ensure the dollars are invested where there are service gaps, that services are implemented, are evidence-based, and metrics are in place to measure the ongoing effectiveness of services provided. CAMIMH understands that you cannot manage what you cannot measure. When it comes to mental health care, considerable service is not covered by our public health insurance plans, and there are data gaps in both the public and private sectors. In our view, much more needs to be done to make care accessible, but also to better understand what care is received. This can be done in collaboration with the Canadian Institute for Health Information and the Canadian Life and Health Insurance Association.
In September 2016, CAMIMH released Mental Health Now, which identified a 5-point plan focused on the federal role in advancing the mental health of Canadians. Mental illness has been a poor cousin of the healthcare system. Considerable mental health care is delivered by health providers other than physicians outside of publicly funded facilities like hospitals, and consequently, it is not funded by our public health systems. CAMIMH recognizes that Budget 2017, and in particular BC 44, is an important step in meeting the government's mandate to make quality mental health care available to those who need it. Hopefully, Bill C-44 is a down payment on the greater investment we need to make in Canada's mental health. The Mental Health Commission of Canada has called for an increase in funding for mental health care from 7% to 9% of total health spending, so our work at all levels of government is yet to be done. More can and must be done to expand the capacity of our public health systems to better deliver needed and effective mental health care. CAMIMH members are committed to this goal and stand ready to make their contributions. In our Mental Health Now document, we call on governments to provide support for the growth of innovative pockets of care that our systems currently fund, and to consider adapting mental health initiatives that have been effectively and successfully implemented in other countries. There is much effective care that our publicly funded systems need to work harder to make available. This speaks to the importance of establishing a mental health innovation fund that can support better access to care that we know works and fund the research necessary to growing our understanding of mental illness and the effectiveness of its treatment. In closing, mental health matters to all of us. There is no health without mental health, and in the view of CAMIMH, Canada's current and future wealth depends on its mental health. Thank you.
Thank you both.